Hello, hello, happy Wednesday. My name is Carmen. I'm a myofunctional therapist. I'm an educator. I'm a teacher, speaker, lecturer, kind of everything. I'm jack of all trades. What I am going to be talking about today is nasal breathing. So my new blog came out today and it was titled The Vicious Cycle of Mouth Breathing. So this is a vicious cycle. Many people, especially if you are a mouth breather, you have no idea that this is a learned habit. It's not healthy. It's not the normal thing to do. So my new blog talks about that because it really is kind of fascinating. So I would encourage you to take a look at that. I am going to be talking more about why mouth breathing is bad for your health. A lot of people think that that's just what they do. That's their norm. And it can be a hard habit to break. I had to do it. I always say that I have the facial structure. So this long facial structure, my jaw angle is all just screams mouth breather. But first let's talk about why mouth breathing is bad. So it is sleep disordered breathing. Anything that causes you to mouth breathe, snore, it can be upper airway resistance syndrome. It can be obstructive sleep apnea. So I always say that it's kind of like there's rungs on a ladder. Mouth breathing is bad. It affects your sleep quality. We don't want mouth breathing here and then eventually it can be sleep apnea. You certainly don't want that. So anything that affects your sleep quality is making you older. It's aging you. It's very degenerative. You need that refreshing, rejuvenating, reparative sleep. So I talk a lot about that. So first I want to talk about the fact that it's important to figure out why you're mouth breathing. Okay, so when I am doing an exam with somebody, I first have to figure out why they're mouth breathing. Is this just a learned habit? Something made them start mouth breathing because we are all born obligate nasal breathers. So something may make you start mouth breathing. Now that can be something like blocked sinuses or a sinus concern, something going on there. It can be tonsil and adenoid concerns. It can be a nasal concern. So that could be deviated septum, that could be, swollen turbinates, polyps, anything else going on. So one of the things when I am doing an exam with somebody, sure, I want to get started with them and I want to teach them how healthy and how important nasal breathing is. But first we have to make sure that they can do it. So I always do a test that tests for what's called patent nasal passages. So I have my clients, and you can do this at home, sit quietly, relax. Now don't try and do it when you've just brought the groceries in or you're chasing a toddler, but sit down after you're relaxed and try and take 20 nasal breaths. Can you do that? What I watch for my clients is, are they collapsing the nares? So are they like trying to suck a milkshake through a straw? Is it collapsing? Is it difficult? Do their eyes get gigantic? Are they having a panic situation trying to breathe? Do they have their shoulders coming up? So those are the things that I'm looking for because it makes absolutely zero sense for somebody to pay me to start therapy with them if I, in fact, cannot establish nasal breathing. So if somebody can't, then I refer them to their ENT so that they can start to figure out why there's a concern with that. For a lot of people, they say, well, I can do it, and so they get through it and they do okay. They just say it's not my normal, which that's common. And I expect that from a lot of clients. But I just want to rule out that I'm not trying to teach somebody nasal breathing and they have this deviated septum that they've been told they should have something done, or they have nasal polyps, that kind of stuff. So it's important to figure out why you're nasal breathing. Then it's important, or not nasal breathing, why you're mouth breathing. Then it's important to figure out how we can get you nasal breathing. So when you're mouth breathing, you are getting less oxygen. So to answer the question on why mouth breathing is bad for my body, you are on a cellular level starving your body for oxygen. So less oxygen means you are chronically stressed. You're chronically in that fight or flight mode. You're chronically having elevated cortisol levels, which is a stress hormone, which that leads to other things. So we see increased acidity. This is, again, chronic stress. Chronic stress leads to, or we see an increase, there's a risk for an increase in anxiety, depression, digestive issues, heart disease, weight gain, concentration issues. So there's just so many things. I always say that oxygen is the vitamin that we all need more of. And so when somebody is mouth breathing, they're just not getting that. So nasal breathing is better for several reasons. Here, let's just talk about that. So better oxygenation. When you nasal breathe, you get more oxygen to your tissues. So that is because you are getting, or one of the reasons you're getting nitric oxide. So nitric oxide is in your sinuses. When you nasal breathe, you have better oxygen uptake into the lungs. So nobody's turning blue. So it's not something, that's real obvious. But if you do a search to watch professional athletes, you will see that there's a lot of professional athletes that they work out with mouth tape because they want to only be nasal breathing. So that's important. The other thing is when you nasal breathe, you're letting the nose do its job. The nose is supposed to clean the oxygen. It's supposed to, or not clean the oxygen. Yeah, clean the air. It's supposed to moisturize. It is supposed to do the job that a lot of people, their tonsils are doing. So that inflamed tonsillar tissue, that is because it's doing the job that your nose is supposed to do. So we want our nose to be doing that job. I talked about nitric oxide. So when you're mouth breathing, you're not getting that. You have to be breathing so that you can get that in the sinuses. And then the other thing is that when you nasal breathe, that forces or it stimulates the growth of the maxilla. So when we talk a lot in myofunctional therapy about the development of the craniofacial bones, when somebody is nasal breathing, that puts an expansive force on the maxilla, which is the middle of your face. So that growth is going to be improved by nasal breathing. So if you're a parent and you're watching this, or you've seen any of my other stuff and you know that your kiddo is mouth breathing, it's important that we get their mouth breathing under control and changed so that we can facilitate the proper craniofacial growth. So that is super duper important. So nasal breathing, that is where it's at. It's the super healthy way. A lot of people just don't understand why. So trying to explain that people who nasal breathe are healthier. Another great thing about getting that nitric oxide is it's antiviral, it's antibacterial. So it's cleaning. So going back to cleaning that air, that's what it is supposed to do. So if you're a mouth breather, it's important to learn how to start nasal breathing. I stumble over that all the time. So I think that explains it to you. If you have other questions, why you are mouth breathing. This is sleep disordered breathing. Remember that. So you do not want to move along that continuum, which could someday be obstructive sleep apnea. So we all need that oxygen. Next week, you guys, I'm not going to be here live. So on 2 Wednesdays in a row, so next week and then also the following Wednesday, I will be on a plane at the time that I'm supposed to go live. So I had no choice but to record. So I will definitely be discussing a topic. My blogs always come out on Wednesday morning, and then my Facebook Live always dives a little bit deeper or answers a different question. So they're definitely connected. So for the next 2 weeks, I have recorded. So you've got recorded Facebook Lives. And then after that, I will be back here. So next week, it's going to be about sleep quality. So continuing on sleep disordered breathing, we will be talking about why sleep quality is important, and then how you can improve that too. So when I do therapy with clients, I teach sleep hygiene, lots of different things. So, and last, if you have questions, if you think you have concerns, don't ignore them. It's important to, admit you have a problem, and then you can seek help. It doesn't have to be me. It just needs to be somebody. If you're snoring, if you have mouth breathing, if you have a tongue tie, if you have open mouth resting posture, if you do not swallow properly, or digestive issues. There are so many pieces of the myofunctional impairment puzzle that it is not just focused on a tongue tie. It's not just focused on one thing. It's more important about the overall wellness. So at the bottom of any one of my blogs, you can get my free assessment tool. This is what my healthcare partners here mostly in the United States and Canada, but anybody anywhere can get it. This is what people can use to screen for myofunctional impairment. So there's 25 questions. If you go through this assessment and you discover that you've got 20 yeses, oh my goodness, you need to be finding somebody. A myofunctional therapist is going to help you understand what you have going on and then what your next step is. So for me, in my practice, what that next step would be is either a free assessment. At that time, I'm not examining you. It just gives you a chance to meet me, see what doing therapy is like on Skype, because I see 100% of my clients worldwide. I do it all online. So that it gives you a chance for that. It also gives us a chance to make sure that we like each other, or that you could put up with staring at my face for 12 sessions or however long it is. But more importantly, it is a chance to make sure that it makes sense for you to move on to a paid exam. I never want somebody to pay for an exam and then I tell you, I think you're fine, you don't have any problems. So that's the thing. But if you want to start with the free assessment tool, go to the bottom of any one of my blogs and you can get that. I'll put that link up here for you right there. And you can take that. There's one for an adult, for a child. Figure out if you have concerns. Then you can Google. You can figure things out. There's a lot of information on my blog. You can reach out to me. That's the most important thing, is that you identify you have a concern and that you move on. Okay, and last, you guys can find me on YouTube. You can find me on Instagram. I have the Tongue Tie and Myofunctional Therapy support group, and that's a great place to get guidance, information. There's other providers in there. There's a lot of different backgrounds there. So I am here. I look forward to seeing you guys in a couple weeks when I will be back live, and you know where to find me if you have questions. I'll see you next time. Bye for now.